welcome to Sister to Sister. We are so glad you're tuned in. It's a virtual expo that brings Black women together for a day of inspiration, entertainment, encouragement, and education online. I'm so pleased to be moderating this next seminar with someone who is no stranger to Radio 1, Dr. Adam Mclaurin. Come on in.
Hey, Chloe. Thanks for having me. I just want to say it's great to be back to discuss a topic that's very important to me. I've worked with many patients who have shared their struggles with fibroids, and it really has become my mission to build awareness about fibroids, as well as any treatment options available to help empower women to make the right choice for them. But I can't think of any better way to get the real story out than to actually speak with some of my patients. So I'm really excited.
Wow.
Thanks for having us.
I'm ready for the real talk. Definitely. Thank you. And Dr. Mclaurin is a board certified and fellowship trained interventional radiologist who joined Radiology Associates of Richmond in 2014 and now serves as Chief of Vascular and Interventional Radiology. Again, thank you so much for joining us. And we have a few special guests joining us today and your patients. Michelle James, come on in.
Hi, Community Clovia. How are you?
I'm doing good. Michelle is a realtor with 10 years of experience working with United Real Estate Richmond alongside a great team. Michelle has been passionate about real estate since her earliest years of growing up in New Jersey. Now, Keyshawn Bailey, how you doing?
Hey, Clovia. Hey, Dr. Mclaren. I'm great.
Thank you, Sean.
Keyshawn is letting everybody know she's 42 years old. She's a native of Red Oak, Virginia, and alumni of Virginia State University with a Bachelor of Arts Sociology degree. Keyshawn has been employed with the state of Virginia for 19 years. Welcome to the show. I am so glad you're joining me today. So, Dr. Mclaurin, today's topic is right in line with the work that you do. Don't let uterine fibroids cramp your style.
That's right. That's right. Yes. Fibroids can certainly cramp your style. Fibroids are extremely common, and they're actually the most common benign tumor of the uterus. And so, so many women have them. They can be present for years and years, not causing any symptoms, and you don't even know you got them.
Mm-hmm.
But when they do cause symptoms, they can be very problematic. Depending on where they are and how big they are, they can cause not only uterine cramping, but they can cause heavy periods, pain, pelvic pain, back pain, difficult urination, constipation. I mean, it goes on and on. Even pain with intercourse and anemia even can result from it.
So, Dr. Mclaurin, who's at risk for developing fibroids?
Really, all women are at risk. If you look at the statistics, about 70% on average, women will have developed fibroids by the age of 50, but only about 25% of women will become symptomatic, meaning they'll develop symptoms from the fibroids. We see that fibroids are often associated with things like obesity, high blood pressure, diabetes, and smoking. But also it's very frequent and actually even more common in Black women. Black women are 2 to 3 times more likely to develop fibroids than other women. And the other thing that I want to mention is that Black women also experience earlier onset of symptoms than other women. Their symptoms are oftentimes more severe. It ends up resulting in a larger uterus oftentimes, and they're more frequently anemic. So it's a very big problem, especially for our Black women.
Wow. And I know we talked about some of the symptoms and attached causes to it, but what really causes it? Is the research still out on it, Dr. Mclaurin?
Yes, ma'am. Like that's a great question, and we are still trying to figure it out. We obviously have made some associations with certain other medical conditions, like I mentioned, but we don't really know what causes them ultimately. There's certainly some. It's probably a mixture of things like genetics as well as environmental factors that play a role. But ultimately we don't, and it's probably different for each woman as well.
Yeah.
Different factors contribute, in different ways to that individual's development of fibroids.
What do you wish women knew about their treatment options for uterine fibroids?
The main thing that I want women to know is that you have choices, and
Okay.
it's not just, and it's not just surgery or suffer. That's the most important thing, because a hysterectomy, a surgical intervention like that is what I refer to as maximally invasive, meaning it requires general anesthesia. You have to have a hospital stay. You have a long recovery, on average, like 6 to 8 weeks. The uterus is removed in total. And so, there's many women who choose to just avoid treatment, thinking that that's their only option, but it's not. I want women to know that there are other options out there. There are minimally invasive treatments, such as what's called uterine fibroid embolization, or UFE, and that's something that I personally perform, and it's done as an outpatient. It's performed with no incision. The recovery time is much shorter, only about a week for most women. It's less risky. All fibroids are treated at once, and the uterus is actually preserved. So there's no removal of the uterus. Yes, ma'am. So it's very. I feel very strongly about this. The message needs to get out, and I really appreciate the opportunity to talk about it.
Yes, I am so glad you are here, and we're going to get into this very important piece. So if you're watching, make sure you're really looking at your screen. Speaking of your patients, I want to transition and talk to your patients about their experiences. So what's the most challenging symptom you've had to endure because of your fibroids? Let's start with you, Kashan.
Oh my gosh, excruciating pain. I've actually had a fibroid resting on my bladder, where it was very hard to go to the bathroom.
Oh God.
And the fibroids were maybe a little bit more than 5 centimeters large. So that's actually maybe the size of a lemon. And so it's just very difficult.
Did you have a lot of heavy bleeding during that time, or just the cramping?
Actually, no, because I was on birth control contraceptives. So that actually kind of stabilized things. So
Really?
I didn't recognize a lot of bleeding, but it's more of just more pain.
Than anything.
Yes.
Wow. Michelle, talk about your symptoms.
Well, my symptoms, Clovia, it was terrible. I had excruciating pain, because I believe I had 5 fibroids, one of them being 5 centimeters as well.
Wow.
And the heavy bleeding, it was kind of like World War III. It was just a mess. I couldn't really go anywhere. I felt like I was hostage in my house for that week. So it was terrible.
How have fibroids affected your day-to-day life and your activities? And you touched on it a little bit, Michelle, but just go ahead and expound on it.
Yeah, it would be things like going to the store, just general things, going to work, basically trying to control it while I'm outdoors was the major challenge for me, because it was just so much of the flow that I constantly had to go to the bathroom, or if I'm at the store, I had to leave whatever was put it back on the shelf and leave and go home, because the overflow was too much.
Yeah, it was too much. And I know we're having this conversation, and there are women who are watching, and they're going through the same thing, because in some instances it can be embarrassing. My fibroid was discovered when I was pregnant. I was about 7 months pregnant. And that's when mine was discovered. I was like, what is this? And so after that, had the baby, and I had my baby late, maybe about 46, that heavy bleeding started. And I'm from the old school. I can hang in there. I can make it, but I don't want you to take that path that I took. They started shrinking when I did turn 50. But Dr. Mclaurin, you're telling us about the uterine fibroid embolization, and we do have options now. So we don't have to go through that cycle of bleeding to try to get to the age of 50, because we think it's going to shrink. But you do have to make some changes to your lifestyle. Right, Dr. Mclaurin?
Yeah, so there are certainly things that you can do with your lifestyle changes that can help, so that, some women actually try a lot of lifestyle changes before they pursue any sort of treatment. And, I definitely support doing things like that. Weight loss is a big thing. Our fat cells in our body actually contain estrogen. They're a reservoir for estrogen, and we know that fibroids respond to estrogen. That's why the symptoms usually occur a little bit later in our childbearing years. After many cycles of our hormones, the estrogen encourages them to grow, and so if we're overweight, we have extra adipose, extra fat cells that are containing more estrogen than normal. And so we know that by losing weight, we can actually slow down the progression of our fibroids.
Right.
Also, vitamin D deficiency has been associated with fibroids. And
Really?
so I definitely encourage, yes, ma'am. So I definitely encourage people to supplement with vitamin D if they aren't already. That can help as well. But
Wow,
just making making just healthy lifestyle choices, along those lines also helps. Just healthy choices with eating and exercise, all goes along with that.
Wow. What was the journey you had to take to get diagnosed with fibroids, Kashawn? Let's start with you and follow that up with you, Michelle.
Oh gosh, I was 23 years old. That's when I noticed that I had irregular menstrual cycles. And I went to a gynecologist, and that's when he told me, oh, you have a fibroid. At that time, it may have been the size of a walnut. But he said, it's nothing to worry about. We'll just put you on the birth control then. Now we're here. I'm 42 years old, and I had the worst pain ever, and it pretty much progressed. And with that, that's when I said to my gynecologist currently, I said, I really need help. I'm in pain. I don't know what to do. And then he referred me to Dr. Mclaurin, and a door opened, and he explained to me what was going on. I wish I had sought more information before now, because I probably would have been in pain from 23, and it gradually increased to 42. So that's why I gave my age, because with this, it could have been taken care of sooner.
Yeah.
I would not have been, my eating habits, the foods that I love to eat, I couldn't eat anymore.
Yeah.
It would just make my stomach hurt. And when I did my own research too, it says fibroids are affected by the foods that you eat, the amount of sleep that you get. So I would be awakened in the middle of the night with the cramping. So those things were an issue. And then finding out that, hey, I'm having a hard time urinating. And it's a fibroid resting on my bladder. So I just went through the motions. It was just horrible.
Man, Stay Free and all of those little products should have hooked me up. Well, I was using them. Oh, excuse me. It's not about me.
Well,
all right.
Well, no, but Clovia, you bring up a good point, actually, and I don't mean to interject here. But
please do.
But one thing that I wanted to mention is, and I don't think this gets enough attention, is the amount of feminine hygiene products that women have to purchase dealing with fibroids. It is incredible. There's something called period poverty, where women struggle to they're making certain choices in their life. Like it could be buying the next meal, even depending on what their financial situation is, and they're having to deal with these fibroid symptoms. So I think it's that's why I feel so strongly about this, that we need to build awareness. Because
I remember those boxes of 48, boxes of 64 within a month, probably less than that, going through the boxes. And again, I'm so glad that we're having this conversation, because a lot of times when it comes to us women, we suffer silently, and in particular African American women, we self-diagnose ourselves. And I don't want you to live in that pain or have that pain, or those fibroids are just growing by leaps and bounds, or, as I did, and I didn't have to, but I didn't know about the strides, or maybe I didn't even ask because I was working around the clock, 24 hours a day. And I cycled every day for 365 for 1 year. Every single day. Yeah. And I don't want anyone to have to go through that. So let's get back over to you, Michelle. Let's talk about sharing your options for treatment for your fibroids.
My treatment for fibroids, actually, it started when I was 29, when I was diagnosed with it. As it progressed, also, it got worse and worse and worse as I aged. And my doctor at that time told me, that option would be a hysterectomy. And I was like, no, I don't think I want to do that, because I'm still young and I might want to have some more children, So no, that's not, you're going to take the motor out of the Honda yet. So
take the motor out. Car won't work.
So yeah,
Sorry,
I couldn't do the hysterectomy. And it just got worse. And now that I'm 44, it is just terrible, and I couldn't deal with it anymore. And I said, you know what, I need to seek other options. And I started Googling, and that's when I found Dr. Mclaurin. And I had my consultation, and him and his staff were great, answering all of my questions and calming my worries.
Yeah. So Michelle, while I have you, how has life been after your uterine fibroid embolization?
Oh, Chloe, let me tell you, it is beautiful. I have not thought that I could actually be this way. I can go outside, I can play around, I can go to the store, and I don't have to leave and put everything back on the shelf. I don't have a heavy flow. I can take long road trips. I'm ecstatic. I'm so grateful for Dr. Mclaurin. I was like, I really should have got this done sooner had I known about it, but I'm so happy about it. Thank you, Dr. Mclaurin. Changed my life.
Music to my ears.
That is so great. All right, Kashawn, talk to us about your options after your uterine fibroid embolization.
Well, he explained all the options. Hysterectomy was not the first choice. I said, I want to keep everything I have as long as I can.
God gave it to him. I'm going to hold on.
And then the myomectomy, and I was like, oh, getting cut? And how long is my recovery? 6 weeks. I didn't like that either. And then he said UFE. I'm like, what is that? Uterine fibroid embolization. And he said the recovery time is either 10 to 14 days. I'm in. I'm going to take that. We're going to see what happens. And when I had that procedure, it was just the best thing that happened. In the first 30 days, I may have felt little butterflies. I guess that's a description. The fibroid's going to be shrinking. So, and then after the 90 days, no pain at all. I am in shock. I just appreciate you, Dr. Mclaurin. I mean, it's the best thing. I'm a foodie. So now all those foods I couldn't eat, ice cream, grapes, you name it, I'm in there. And so it's the best thing.
Yeah. Well, I want to say you put me under some pressure, though. When we met, you had big plans. And because I was like, now, Dr. Mclaurin, I have this big trip plan going to Jamaica. Am I going to be ready for Jamaica? And I said, well, how long you got? So I think you were going to go in about a month, I think, after your treatment. And tell us, you were able to do that successfully and had a...
Yes, I was able to do that successfully. And like I said, no problems. I just made sure that, hey, you said, I need 10 to 14 days. Can we push it to 10 days? I need to get back to work. And sure enough, he guaranteed me that you'll be fine in 10 days. In 10 days, I was able to go back to work after procedure and just take it easy. That was it. But yeah, I was able to have fun and not even think about any pain on my Jamaica trip.
Yeah. So during the process of that pain, Kashawn, was there heavy bleeding also? Or not?
No, because the birth control actually controls that.
Mention that.
So I didn't have those issues.
Yeah. All right. Michelle, was that
being on that contraceptive?
Yeah. So Michelle, did you have any heavy bleeding, or were you on birth control too?
No, I was not on birth control. I was actually just straight and forward, and everything was quite natural for me. Yeah. So there was a lot of pain and a lot of heavy bleeding for myself. Yeah. I had nothing hold me back.
Yeah, Dr. Mclaurin, you want to jump in?
Yes, ma'am. I just want to say, birth control is certainly an option, and it's a non-invasive option, and it actually works for some women. But usually, what happens is it works for a short period of time, generally about
Yeah.
6 months, and then
Mhm.
the symptoms will start to rear their head again. And you have to be very careful with, make sure that your gynecologist is,
Yeah.
aware of the cause of your bleeding, because if they put you on a certain kind of birth control, one
Mhm.
that actually contains estrogen, then that is a problem. That actually can encourage fibroid growth. So you have to be the gynecologist has to be cognizant of what's going on to make sure you get the patient on the right medication. But in general, most of my patients, they've tried it and it failed. So that's how they usually find me. That's usually the first step that gynecologists take.
Dr. Mclaurin, I have a question because my gynecologist took me off birth control in my mid-30s. So is birth control advised after 40?
If you are suffering from fibroids, heavy
Uh-huh.
bleeding from fibroids, then yes, you can certainly try birth
Okay.
control. There's nothing. Yeah, there's definitely an option.
Okay. All right, ladies, let's start with you, Kashan. Do you mind sharing a little bit about your experience? I know you praise Dr. Mclaurin, but your experience with Richmond Vascular Center, and of course, Dr. Mclaurin.
Well, when I went there, they were very welcoming. They were like, hey, you need anything? We're going to do the best we can to make you feel comfortable. And they did.
Yeah.
Even to meeting Dr. Mclaurin, he explained everything from A to Z, what a fibroid is, to the procedures that are going to happen, the percentages of with African American women versus other women, and having these procedures, what the outcomes would be. Even saying that once you have this UFE, the uterine fibroid embolization, which I had, you have an 88% more chance of pregnancy, if you like. So those things were very, very important to me. And after the procedure, 90 days after the procedure, they followed up with me from the 30-day to the 60-day to the 90-day. And it was just overjoyed. I was overjoyed with just knowing that they cared. That's what I felt like. They cared, and that my health was important to them. And so I just appreciate everybody in their office and Dr. Mclaurin. Just thank you. I don't
Kashan,
thank
how
you.
long was that ago?
I had my procedure June 3rd
Of this year?
Of this year.
Wow.
And I went to Jamaica on June 27th.
Really?
July 27th, 30 days later. I'm sorry.
You rolling, Dr. Mclaurin. So, Michelle, let's talk about your experiences over at Richmond Vascular Center and with Dr. Mclaurin.
Like Keyshawn said, they were very welcoming. The whole staff was very supportive. They answered all of my questions. Dr. Mclaurin came in and he reiterated and made me feel comfortable about having the procedure done. He explained everything and let me know what it is, and and he answered any questions, because I was really actually very skeptical about actually having it done, because I've never heard of it before. So I'm real skeptical with my health, but they were very very inviting. So, and they made me feel very comfortable, and that was very important. If I had wanted to have kids again, it was also an option, and that was very important to me as well. So I did, like I said earlier, I wanted to preserve the motor, and that's what Dr. Mclaurin did for me, and I thank him and his staff so very much, because it's been going on for a long time.
Michelle, sounds like you want more kids, Michelle.
I may have, but don't tell my husband.
Okay, I'm just saying. You're trying to think up a baby since you don't have no painful sex no more. Oh, is that a part of the show? Oh, I'm sorry. Oops. Well, okay. All right, Dr. Mclaurin, before we close out, right? But you know what? Let me go to Kashan and Michelle first. All right. you have your girlfriends, whether they're watching this or if you would have a conversation with them and they've just been diagnosed with fibroids, what would be the first thing you tell them? Let's start with you, Kashawn.
I would say, girl, you got to meet my doctor, Dr. Mclaurin. He is the
Hey.
bomb. Okay. He's going to explain everything to you. He will actually guide you on day-to-day, just a schedule on what to do to get ready, prepare you, and he will make you feel wonderful in the end. I mean, a blessing to me. So I would definitely encourage them to try this uterine fibroid embolization procedure. It is just awesome. And, try to preserve whatever you have, the motor.
Keep the motor running, baby.
Keep the motor running.
All right, Michelle.
I would definitely introduce them to Dr. Mclaurin and have them come in and talk to his staff, and so he can answer all of their questions. Because I know a lot of my girlfriends are pretty much the same as I am. They're very skeptical, very they're worried about their health. But if they're actually suffering in silence, I definitely encourage them to go and talk to Dr. Mclaren over at the Richmond Vascular Center. He's great.
Thank you so much, Michelle and Kashawn. And I don't know why, as African-American women in our culture, we will suffer silently. And we try to make it through with the cramps, with the heavy bleeding and all. But we don't have to do that anymore because we have Dr. Mclaurin and we have options if you've been diagnosed with uterine fibroids, right? So Dr. Mclaurin, before we go, talk a little bit about uterine fibroid embolization. And if people need to make an appointment with you, what should they do?
Sure. Well, if you want to just come, I don't put any pressure on anyone about making a choice. I'm here to talk and to explain what your options are and allow you to make that choice. So the first thing is, if you'd like to come see me, visit www.richmondfibroids.com. That's the easiest way to get a hold of me. But I will, to go over the procedure itself, we do this in our office. We have a setup here at Richmond Vascular Center that is equivalent to a hospital. But you don't have to go to a hospital. You can come right here to our office. And you come in and you get an IV for a light sedative. And we do the procedure using ultrasound, where we place a small catheter, which is like a plastic tube about the size of a spaghetti noodle, inside a blood vessel, either in your wrist or in your groin. And then we use X-ray to guide that little catheter into the artery that is supplying blood to the fibroids. And then with X-ray guidance, we then very carefully deliver these microscopic beads into those blood vessels going to the fibroids, which results in blocking the blood supply, which is also referred to as embolization. And then once we blocked up the blood supply, the catheter comes out. We put a Band-Aid on your wrist or on your groin, and you're able to then go home and recover in the comfort of your own surroundings. And then over time, the fibroids shrink and your symptoms get better. So as Kashawn was referring to, is we take a lot of pride in making sure that our patients feel supported throughout this whole process. It's very important to me that they feel like they can rely on us. And so the day after the procedure, we always call the patients to make sure they're doing okay. And we always have someone on call 24/7. So if they ever have any questions or concerns, they're able to get a hold of us at any time. And we set them up for success as best we can. So I explain everything from, A to Z, so that they're armed and ready to get through this, through the procedure, so that they can get control of their life again.
Dr. Mclaurin, what are the chances of the uterine fibroids returning after the UFE?
Very small. There is, if we look at 5-year follow-up comparing surgery to embolization, the quality of life improvements are the same. So it's equivalent. 90% of our patients see basically either dramatic improvements of their symptoms or complete eradication of their symptoms. I will tell you, I have not had to go back and retreat anyone over the years. So,
Wow.
we usually patients, we see them at 1 month and 30-day follow-up. And at the first month follow-up, it's hit or miss. Some patients are doing great. Michelle was doing great at 30 days. Other people need a little bit more time to get to see the real improvement in their symptoms. And generally, by that 90-day visit, they're seeing that their periods have gotten significantly better, and their other symptoms like cramping and those what we call bulk-related symptoms, like the difficulty with urination or constipation, have started to get better too.
Mm-hmm.
So we rarely ever see them come back with continued symptoms. But if they do, we have a system in place that will address it, and patients can have a repeat embolization if they need it. Occasionally, there are other blood vessels that develop that we have to go back and treat, but that's very, very rare. I would say it's less than 2% that we have to do that with.
We don't want to give it any blood, right? Cut off the blood supply.
That's right. That's the problem. That is the problem.
Yeah. Well, I thank you so much for being here. A lot of great information shared today in reference to your body. Any cramps or backaches or, heavy periods, just feeling awful, please contact your doctor, or better yet, reach out to Dr. Mclaurin for help so we can get treated. That's important, right?
Yes.
I see you
Very
smiling.
important.
Y'all all excited. For 1 year, I didn't
Very.
smile. Whew, Lord Jesus. Don't let uterine fibroids cramp your style. Dr. Mclaurin, Kashawn, and Michelle, we do appreciate you. Thank you so much for joining us. God bless you. I'm out. Peace.